Hello, this is Ken Barron. I'm with the National Association of Black and White Men Together, and I welcome you here today. Today is an interesting day from the Supreme Court, at least, because they blocked Biden's COVID plan. I believe it was this week. And if you're suffering and have suffered from COVID, you may be fortunate, like myself, and have been fully vaccinated or survived the COVID infection. And so you may be wishing we all would be vaccinated. And you're also irritated, perhaps, that many are not. The Supreme Court has blocked President Biden's plan to require that most workers be vaccinated against COVID-19 or undergo weekly testing. In a separate decision, they upheld a more targeted regulation that will require about 17 million people in hospitals and nursing facilities to be vaccinated. Apparently, the president had, quote, overstepped his authority, end quote, by requiring workers in companies and agencies with more than 100 employees to be vaccinated or tested regularly. Once again, the majority of conservatives on the Supreme Court voted 6-3, and they gave the information that Congress could have used OSHA, the power to regulate occupational dangers, but is not given that agency the power to regulate public health more broadly. The three liberals said the federal government's ability to counter the unparalleled threat that COVID-19 poses to our nation's workers should be considered. The testing requirement for hospitals and nursing homes is based on the Medicare and Medicaid Acts, which authorize federal health officials to set standards to protect the health and safety of elderly and sick patients. I'm very disappointed in the OSHA ruling and still advocate for employees to do the right thing to protect Americans' health and its economy. The outcome is not a surprise. The conservative majority is highly skeptical of the new and far-reaching federal regulations. They prefer that states should work on this. The problem that in this approach is that COVID does not respect state boundaries. Businesses and states told the court it would cost businesses billions of dollars to comply with the vaccinate or test rule, and they predicted it would cause hundreds of thousands of employees to leave their jobs. The administration, however, said the rule, if enforced, would save more than 6,500 lives and prevent hundreds of thousands from being hospitalized. A study of nearly 70,000 COVID patients in California demonstrates that Omicron causes less severe disease than other coronavirus variants. Results that are aligning with similar findings from South America, Britain, and Denmark. Across the United States, 25% of eligible Americans are not vaccinated against COVID-19. More than 62% of the county has been fully vaccinated, but only 23% are boosted and fully vaccinated. Omicron caused 98% of the new coronavirus cases in the United States last week. And despite some of these aggressive actions, COVID numbers are still rising and affecting the area's Black residents in a major way. NAACP President and CEO Derek Johnson said the COVID-19 pandemic has plagued our nation for 20 long months now, but all of the devastating effects, whether health-wise or economic, disproportionately impact our Black community. For example, in D.C., Black residents account for 49% of the total positive cases in the nation's capital. In comparison, white residents only account for 22% of Washingtonians who have tested positive for COVID-19. Black and white D.C. residents make up for an equal number in the district. Also, Black Washingtonians account for 77% of those who died from complications due to COVID-19. Once again, people of color are hard hit. Here at the Nabwmt, our mission statement calls this as immoral. Let's all fight for equality in healthcare and other inequalities. Thank you for listening. Please subscribe to our channels, Facebook, YouTube, and Twitter, and comment if you wish on this down below. And please like us. Thank you for listening.